How did early mobilization revolutionize stroke recovery? Imagine waking up after a stroke and being encouraged to sit up, stand, or even walk within the first day or two. This approach might seem risky at first, but it has actually transformed how we help stroke patients recover. Early mobilization means getting patients out of bed and moving as soon as it's safe, usually within 24 to 48 hours after the stroke. This shift in care has led to better recovery outcomes, fewer complications, and a quicker return to daily life. In the past, doctors often kept stroke patients on bed rest for many days to avoid potential problems like falls or blood pressure drops. But research over the last few decades has shown that waiting too long to mobilize can slow recovery and increase risks of complications. When patients start moving early, it stimulates the brain's natural ability to repair itself, a process called neuroplasticity. This is the brain's window of opportunity right after a stroke when it can reorganize and form new connections. Gentle activities like sitting up in bed, sitting in a chair, standing, and walking help improve blood flow to the brain, activate muscles, and encourage neural reorganization. Clinical studies have shown that patients who begin mobilization within 24 hours tend to regain more independence in daily tasks. They often score better on scales that measure disability and ability to care for themselves. The key is to start once the patient is stable, with sessions lasting around 15 to 45 minutes, 2 to 3 times a day. Activities are usually progressed gradually, starting from simple head-of-bed elevation to sitting, then standing and walking as tolerated. Safety is a major concern, but evidence shows early mobilization is safe even for patients in intensive care units or those on ventilators. The risk of falls or other adverse events remains very low when proper protocols are followed. Additionally, early movement helps prevent common complications of immobility, such as pneumonia, blood clots, and muscle wasting. While some studies suggest that mobilizing within 24 hours may not prevent all complications, overall, early mobilization has been linked to shorter hospital stays and better long-term recovery. This approach has also changed how hospitals care for stroke patients. It encourages teamwork among doctors, nurses, physical therapists, and other healthcare professionals. These teams work together to create personalized plans that promote safe and effective movement early in recovery. As a result, patients often leave the hospital sooner, with improved strength, less fatigue, and better ability to participate socially and return to daily routines. In summary, early mobilization after a stroke has revolutionized recovery by harnessing the brain's natural healing processes. It improves physical function, reduces secondary health problems, and supports faster, more complete rehabilitation. Of course, every patient is different, so healthcare providers carefully tailor mobilization plans to each individual. Always consult with medical professionals to determine the safest and most effective approach for each person.